Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Diazepam. Diazepam is the drug of choice in central spasticity. Diazepam is the drug of choice in central spasticity. It is the drug of choice in picrotoxin poisoning, and it is the drug of choice in strychnine poisoning. So, diazepam is the drug of choice in central spasticity, picrotoxin poisoning, strychnine poisoning. It can be used in febrile seizures, and it is in fact the drug of choice for febrile seizures, and it is also the drug of choice for convulsions in tetanus patients and delirium tremens. So diazepam is actually the most commonly used sedative also, and also it is the most commonly used sedative and hypnotic with a half-life of around 100 hours. It is the drug of choice for febrile seizures. It is also the drug of choice for drug-induced hyperactivity. If there is any type of hyperactivity due to drug-induced, it is used in pecrotoxin poisoning. It is the drug of choice for prevention of seizures due to lidocaine, or in drug-induced external Parkinsonism symptoms, extrapyramidal symptoms also. It can be used. It is used as for drug-induced extrapyramidal symptoms also, or it can also be used for manic phase of bipolar disorder.
thank you and thank you for watching.